support each other. They'd help take care of kids together. They would take care of the management, daily management of the shelter together, and that there'd be this kind of, in my view, perhaps an idealized way of thinking about how women might want to come together to develop a supportive environment. Well, this, not surprisingly, turned out to be a little more challenging than the early workers, I think, anticipated. By the way, I want to note that I'm using the term women intentionally here because I think in the early days, the work was pretty clearly organized around the idea of women fleeing violent relationships, particularly relationships with men. And I think over time, we've come to recognize who was left out of that equation. And there were many struggles, certainly especially early on, that I think to some extent continue today, to elevate LGBTQ rights and the needs for folks in that community for safety. And then also activists of color in the initial days of the movement really fairly put aside that the early shelter movement is not sufficiently including their voices either. So the early work did not sufficiently consider the totality and the complexity of who might need to access shelter. So next slide. So as I said, the reality, I think, was quite different from the idealized view that women would just come together and kind of naturally work things through. People didn't always really get along. People come from a variety of different backgrounds, they have different experiences, different life challenges. Shelter workers came to realize fairly quickly that some of these challenges were just kind of making themselves apparent in shelter, kind of helping people from different backgrounds figure out how they're going to work together and live together. People just really live their lives in different ways, as I think we all know. Everybody who works in shelter knows that, and certainly now. People have different ways of communicating, different ways of caring for their children, different ways of addressing conflict. All of that kind of is brought into the shelter movement, and I think has really presented challenges for all of us throughout the years. We also, in the beginning, I think, didn't really know very much about how trauma affects behavior, and there hadn't been much research into risk and danger in domestic violence cases, so I think we didn't really know very much about kind of the range of experiences that people might bring to shelter. So understandably, as conflicts emerged and staff people began to grapple with these issues around shelter management, conflict, safety, and other important issues, shelters began to develop rules as a way of kind of organizing and structuring the shelter environment in order to provide a good environment for workers and for shelter residents. By the way, when I say this about rules, I just want to emphasize, I'm not suggesting that rules are unimportant or that shelters shouldn't have them. My point is just that to provide a background for, I think, how we came to think about and structure our actions as shelters. So today's topic is safety in shelters. And I just want to say that the presentation that I'm going to give you is really, it's kind of just me talking. As I said, this is based on my experience in working in shelters, in talking with residents, and talking with other advocates, and reading and learning about how shelters do their work. And so you might agree with some of what I have to say, and you might disagree with it. And so I'm really hoping that we will have a robust discussion at the end of this about what folks are all thinking. So let's start by defining what we mean by safety. Next slide. So first, it seems to me that safety can mean different things to different people. And that depending on who you are, what your background is, what your social position is, what your standpoint in life is, that a lot of different things about who you are as an individual might affect what safety means to you. And I thought it might be useful to see what the dictionary says about what safety means. And I looked at a number of different sources from different dictionaries, and pretty much everybody said the same thing. They defined safety as a condition of being free from hurt, injury, or loss. Which seems like a pretty good definition, but it also raised some questions for me, like what makes somebody feel safe? How are we thinking about what hurt, injury, or loss means? Does the structure that we provide really help the people who come to live in shelter feel safe? And if so, what are we doing that produces that feeling of safety? And if not, what are we doing that might miss the boat? And then also, if I don't feel safe where I am, how does it affect behavior or how it is that I decide to conduct myself or how I interact with the world? So first, I wanted to talk about safety for survivors and shelter residents. So we can go to the next slide, Twyla. So for people seeking shelter because they're experiencing violence in their homes, I think it's fundamental that the first thing we think about is safety includes being in a place where the person who is harmed them does not have access to them. And in order to accomplish this, most shelters, of course, keep their location confidential. They generally have rules prohibiting disclosure of the address of the shelter and disclosing any information about the identity of someone who lives there. A shelter might install a security system, develop relationships with local law enforcement who can assist if there's a threat from someone who has harmed someone who's living in the shelter, and to limit opportunities for access there. Most shelters also have a rule prohibiting shelter residents from using violence in the shelter, usually including corporal punishment of children. Shelters are generally wanting to promote a violence-free environment within the shelter, as well as trying to keep external threats from coming in the shelter. So that's the kind of whole notion of physical violence, which is a type of hurt or injury. But then there are other ways of experiencing hurt, injury, or loss. So what's required for someone to feel emotional and psychological safety? And I was also really intrigued by the dictionary definition and inclusion of freedom from loss as an aspect that really defines whether safety is present. And as you are all aware, people are experiencing a lot of loss when they come to shelter. So that was just an intriguing part of the definition for me that I think we'll talk about a little bit here. So what I'd like to do now is take a few minutes to talk about what your experiences tell you about what else survivors of violence might need in order to feel safe. So I'll ask Twyla to kind of help us with eliciting some of your comments about that.
Hey, there's some more people joining. It's great. But yeah, if you all are comfortable, whoever wants to turn on their cameras and, we can have a free, open discussion. I would love to hear you all and see you all if you feel comfortable to discuss where we are in the presentation here and your thoughts around this subject. So if anybody wants to chime in, have any questions, thoughts, please feel free.
Don't everybody talk at once. So what else do people need besides just the security of the physical building? What do people need in order to feel safe in shelter?
I'll chime in. Hi, Denise. This is Vicki from, nice to see you too. I work for 360 Community Service House. So we have 2 shelter programs. What do people need other than physical? Well, I think they need staff on site to be here and not to create more for that emotional safety piece. So they have somebody to talk to and listen without judgment. I think they need, and having just having a roof over their heads is obviously creating a different kind of safety, but consistency and support with what and kind of safety planning. That's where my brain was going, in that unique safety plan, and having individualized safety planning. That's the word I was going for. And something that comes to mind when thinking about this as well. comes up a lot here. People like really want to have a place where they can store their belongings that they can keep safe. That like we use like lock boxes, or we have safes in the rooms for people to lock up their things. That is something that comes up. I know it's a lot. Being able to lock their bedrooms is something that comes up. Yeah. Sure, there's more, but that's what I'm thinking of right now.
I'll chime in too. This is Joan from Women's Advocates. Hi, everyone. And hi, Denise. I think feeling like they belong when they walk through the door, that it's hard to leave an abusive situation or a violent situation and walk into a new place. And so making sure they're given like a tour of the area, where they can get their food, how they can make their beds, giving them all the sheets and blankets, and making them feel comfortable in the space so that they don't feel like they need to leave to go back to something that is unsafe. Giving them time, I think, sometimes makes people feel safe. So you're not just at them from the very beginning, trying to gather as much information as you can, but giving them time to share their story in their own timeline and way. And that's all from me. A good cup of tea.
Hi. For one, we have very minimal rules here. So it's not where people are always worried they're going to be kicked out, or asked to leave for not following rules. The other thing is we do a tour, like Joan said, and we also have a welcome booklet at each bed that gives a lot of information about resources and how things work at the shelter, because not everybody's comfortable asking questions. And so it's definitely not something we just say, oh, just go read the welcome booklet, but because we like to have the conversations and open communication. But like I said, not everybody's comfortable making those, that initial reach out with questions when they're new.
So we just had a few more people join. We are having an open discussion around what do people need in shelter to feel emotionally and psychologically safe. If anybody that just joined wanted to jump in the conversation.
Hi, this is Carrie from Home Free. I think about like even the language that we use and having it be, gender neutral, so that we are welcoming to everybody. Also, even having like, we have a great big welcome sign with a whole bunch of different languages, and being able to provide space for immigrant women to have their cultural food, providing interpreters, various things like that, I think can help make a safe environment.
Hi, everybody. I'm Steph. I'm from Women's Advocates. This is my first meeting, so nice to meet y'all. I think that when somebody is walking in for their first day in shelter, it's a really scary experience, and not rushing them into completing paperwork right away and kind of just giving them the space, like, what else do you need? Are you hungry? Have you eaten? Do you want to take a shower? You know, providing those basic needs so that they may be ready in a little while to be able to open up to you. But a lot of our intake paperwork, not even just at Women's Advocates, but, you know, across the entire housing continuum, asks a lot of really difficult questions. And they may not be in the space to provide that information right away. So letting them get settled, letting them get comfortable, showing them around the space, as somebody already said, and making sure that they know that there's a relationship that's forming, there's trust that's building, and then they may be more comfortable in answering those really difficult questions.
So I'm really loving this discussion. And if it's okay, Twyla, I'd like to kind of move us along because I want to make sure we have more time at the end for these discussions. And actually what people are raising is really parallel to some of the things that I wanted to talk about and some of the things I think I've already mentioned. Vicky's first comment about staff on site was interesting to me, because you may or may not know that actually in other parts of the world, there are no staff and people are kind of shocked sometimes to learn that in the US, it's very typical for these shelters, pretty much every shelter staff here. But then Vicky went on to talk about the need for that being connected to emotional safety, you know, listening about judgment. And I really like this idea of recognizing that that people need to secure their belongings. You know, that means if you think about that freedom from loss idea that the dictionary tells us is important to safety, is kind of parallel to that. That, you know, that recognizing that people need to feel like they're not going to lose all their stuff. You know, and oftentimes people are coming with really minimal belongings. So, and when people are talking about, you know, the feeling like people need to feel like they belong. Where can I get food? You know, what's it going to be like to live here? You know, all those kinds of things, and not rushing into assuming that everybody is going to be able to walk in and have the same experience walking in. That people are going to be really experience shelter really differently depending on what they've just been through, depending on who they are in the world, depending on their life experience. So I'm really, really loving the comments that people were making about that. So can we go to the next slide, Twyla? One of the things that we know, I think we kind of knew this in the beginning when shelters were starting, you know, almost 50 years ago now, but I think we really know for sure now is that people's life experience is very complicated. People don't just bring in the sole shared experience of having lived through violence. People bring everything that they are into shelter. They bring their cultural identity, whether it's, you know, a racial or ethnic identity, whether it's LGBTQ status, whether it's disability, whether it's age. I mean, all of those things. I mean, everyone is something within that whole cultural identity thing, and everyone brings that, and everyone is different. Some people have substance abuse issues and mental illness. Many people bring the experience of poverty, which also can affect how they view shelter or how they engage in shelter. Some people come in with a criminal record. And we know that the social economic safety net has really been frayed in recent years. And so I think what we find these days is in some ways more challenging even than it was a number of years ago, because just as one example, you know, years ago, if you had something on your criminal record, it didn't necessarily prevent you from getting housing or, you know, public assistance or, you know, a job or, you know, anything like that. And nowadays it can have a huge impact. And so people are bringing all of that into shelter, and with all of the uncertainties that can come with it. And then we're sort of, you know, left to try to help them. The other thing I want to talk is about trauma. I mean, clearly, and I think we all know again that that trauma affects how people behave. It affects how people engage with the world. It affects their ability to trust. It affects, their feelings of security in the world. And so all of these things, I think, can come together to impact how people engage with shelters. And so if we're going to be positioning ourselves to help people be free from hurt, injury, or loss, it just makes sense that we've got to keep all of that in mind about everybody who comes into shelter and how we can best work with them to increase their sense of safety in the broadest terms. So the next thing I want to talk about, I'm going to shift a little bit and start to talk about safety of advocates and shelter workers, because I think that's come up quite a bit in recent years. And everybody, of course, needs a safe workspace, right? I mean, nobody wants to come to work and feel unsafe. So let's talk a little bit about that. There is sort of an inherent risk, and I hope that, I think we all know that when you're working with people who have experienced violence and there's someone who really wants to hurt them and we're sheltering that person, that there is an inherent risk, a physical risk to staff from the external threat of an abuser who might want to come in and do some harm to someone in the shelter. And it also seems to me like everywhere you look today, that whether you're doing ordinary things like going to the grocery store, or going to a concert, or that people are experiencing harm in ways that it seems like it's happening more. Perhaps we're just talking about it more, but certainly there are just inherent risks in the world. I think a lot of us feel sort of off balance. And of course, again, our work is premised and focused on promoting safety. So we really want to build in everything we can to help our workers feel safe and comfortable coming to work. But we know sometimes people feel unsafe. Sometimes advocates tell us they feel unsafe. So I want to explore that a little bit. Again, I'm intrigued by this definition of freedom from hurt, injury, or loss in relation to shelter staff. And one of the things I want to talk about is that it's my understanding that sometimes the feeling of being unsafe for workers stems from the conduct of shelter residents. And so I'd like to explore that a little bit. So, of course, pretty much every shelter prohibits use of physical violence, right? And that's a given. But I think, you can tell me if I'm wrong, that actual physical violence towards shelter staff happens, but it's relatively rare. But, people get asked to leave shelters for a lot of reasons, short of using actual physical violence. Advocates sometimes leave their jobs because they don't feel like safety is prioritized in the organization. So it seems like it's more than just the absence or clear threat of physical violence that perhaps people are reacting to when they feel unsafe in the workspace. So what else contributes to this feeling? So Twyla, I'm going to again turn it over to you and see if we can get some conversation going about what people feel like might make a staff person feel unsafe in the shelter.
Okay. I put the little blurb in the chat too. I'm not sure what that second thing is that I posted, but disregard. So if anybody wants to turn on their cameras again, jump in. I know my dog would like to say something. So sorry about that. Please feel free, because I think that I need to quiet her now. I apologize for this.
Hi, this is Bethul. I have joined and I can hear now. Can you repeat the question? Was it about the staff people or those in shelter? Can you repeat that?
The question is, what contributes to a feeling, or what could contribute to a feeling where staff people feel like they're not safe at work? And in particular, this might not be the only thing, but in particular, I'm thinking about conduct of residents, because we ask people to leave shelter because we feel like they've done something that sort of violates this whole notion of safety and shelter. And so, what is it like? Can you describe that conduct, or what people might be doing that contributes to that? To staff people feeling unsafe. That makes sense, Nicole?
It does, yes, thank you. I would think some of the behaviors of the residents that may be taken may be or mistaken as aggressive because they are already emotionally heightened. They're already going through challenges and chaos dealing or stemming from abuse. They're not stable. So in their actions and their reactions and responses to whatever it could be maybe they do have to leave. Maybe, there's drugs involved. Maybe there are children. Maybe there are multiple things, but it's the demeanor of the people that we're working with that shifts, and it causes these emotional imbalances that make us all a little weirded out. And I don't know if it's necessarily a safety concern sometimes, because I believe most of us can possibly pretty much take care of ourselves. However, we don't want to have to be put in those positions. But at the same time, it makes things very uneasy and very uncomfortable.
I think too, Pathul, you said that really nicely. This is Joan from Women's Advocates again. I think too, it's the uncertainty of what the behavior is going to be next. Like you'll keep someone in shelter and they'll act out in a way that brings people to the state of being worried of the next encounter. What is going to happen at the next time? And I think that gives people a sense of unease, the unpredictability and the uncertainty of what's going to happen next. And I have a 8-hour shift and I have to be here overnight, and day staff reported or passed on this information, and now here I am wondering and worrying what's going to happen, and how I need to react. And sometimes, it does come down to, really, really hard things with mental health and chemical health. And, we just had a very difficult situation in shelter at Women's Advocates that frightened a lot of people that worked there. And so we've done a lot of work to kind of come together and heal around that situation. But someone making threats, someone throwing things, someone walking around with a weapon, unpredictable drug behavior, things like that. But then it's even if the situation's taken care of and you say, hey, we need to really continue to try to house this person or this family, let's get these resources in place. While you're doing that, staff are very uncertain and feel unsafe.
We talk a lot about, so I agree with Joan and everybody else that's actually spoke already. I feel like same things. We see the same things. A lot of, staff feeling unsafe because maybe they're not as confident on how to deal or handle a situation. Also, we're kind of processing and thinking about with each individual staff, like what's uncomfortable and what's unsafe. Because some staff will say, oh, I feel really unsafe. Well, is it that you're unsafe, or is it that you're uncomfortable with addressing this difficult conversation as well? So I think something to kind of reflect on as well.
I think I'll just take the mic back and because I think what y'all are saying really is kind of the same direction that my thinking has been going as I've been preparing this time to talk with you about. I really love that analogy of is it safe or is it uncomfortable? I mean, am I uneasy? What is really happening here? And so that's kind of exactly where I was kind of hoping that we would be able to go with this. So let's go to our next slide, Twyla, to kind of conclude my part of this, to give you all an opportunity to talk amongst yourselves. What I want to talk about now is, so what can we all do? Like, what can be, how can we effectively address safety for everybody in the shelter? And what I want to say again, this is me talking, and I'm happy that it sounds like we're talking in pretty much the same direction. So first of all, I want to say that this work is incredibly hard. And you all, of course, are to be commended for being willing to do such challenging work. Frequently for little pay, and as we've already noted, working conditions that sometimes carry risk of harm. And it's sometimes really hard to know what the right thing is to do. And sometimes we're going to make a mistake. Sometimes we're going to make a wrong decision. So I don't mean to be glib, and I hope I don't sound that way. I think some of you are really already echoing some of what I wanted to say here. But I think that by training and inclination and experience, my belief is staff can do a lot to help to promote an environment that feels safe for everybody. And of course, these things aren't a magic wand that's going to solve everything. And they're very hard to do, and sometimes they don't work. I think that Joan in particular was talking about how sometimes you do reach a point where it just isn't going to work, but that we can do a lot to help not get to that point. So here are some things that I think are helpful. We know that people who've experienced trauma, which is going to be just about everybody in the shelter, is going to have experienced trauma. So some people are hypersensitive. Some people are really easily triggered. They might become angry or even aggressive. And I think it was Bethel was talking about how people come with, my notes here, that they feel really unstable. The ground underneath them is shifting, and that can really make people feel very uncertain, and can really make people behave in ways that kind of act that out. And so we have to be prepared, of course, to respond with compassion and not overreact. And I think that I would add that even sometimes things like requirements that people have to do house jobs, could parallel for them the experience where their abusive partner was trying to control, and demand them to do housework in particular ways. Things like not having, how they can access food or basic needs. That kind of thing can be really triggering for people because, again, it can parallel the experience from their partner. And when people feel that way, they feel really uncertain. And so they might act in a way that might look like defiance, but is actually perhaps a trauma-based response rather than something that's based on anger or aggression or trauma. Of course, we have to develop our own self-awareness. We got to check our own assumptions at the door, which is really hard to do. We have to be aware of our own biases, our own beliefs about how people ought to operate in the world. People might talk, look, behave in ways that are unfamiliar to me, but I need to have enough self-awareness to catch myself, and I think I'm reacting to that rather than really evaluating resident behavior for what it really is, just kind of bringing who they are, or perhaps having an experience of trauma. I think that this whole notion of people have talked about mental health and chemical addiction, and I think this is really important, and it's really, really hard. But I think that there's this whole intersection of homelessness, addiction, mental health, violence that people bring with them to shelter. And in some ways, I think those lines have just become really, really blurred, particularly the line between what's homelessness and what's someone feeling violence. And so people might have fled and not been able to get into shelter, and so they're trying. And so now when they finally get encouraged getting into shelter, are they homeless or are they feeling violence? Or someone can be homeless and then be beaten and then request shelter. And so, that line, I think, is increasingly blurred, particularly as homelessness continues to be on the rise in our country. And the whole notion of chemical illness and chemical dependency and mental illness is also a big challenge. We certainly discovered that in the JSHP project, the hotel project. My personal belief is that if we tell someone who has a struggle with a substance abuse issue that they cannot use in their own shelter, we're pretty much saying they're going to get kicked out. Because if you have a substance abuse addiction, you're probably not going to be able to stop cold turkey. And so I think we have to be really thoughtful and planful and careful about how we're interacting with people about that and how we respond if someone has been using. Similarly, many people, if they didn't have a mental illness or some form of mental illness, even if it's depression, which is a very common form of mental illness, will frequently develop it as a result of their experiences with homelessness, domestic violence, etc. And so what are we positioned as staff to do? And what is beyond our ability to do? When do we have to kind of say, we've done what we can, we got to figure something else out? And the other thing that I think is really important is how can we position ourselves? How can we partner with and connect with other organizations and agencies with expertise in those areas so that we can improve our capacity to respond with a compassionate way and also not to be overreacting to what we're seeing. I want to talk a little bit about violence because I think everybody probably on this webinar knows that batterers have become very skillful at using the legal system against victims of violence. And so people will come to, will often be seeking shelter with a criminal record. And if you look them up, you see if they have a violent criminal record, or they might be subject to an order for protection. And so it's really important to recognize and kind of factor understanding what that violence is, what's the nature and scope of that violence, what's its meaning, what's the context, so that we're not, unnecessarily excluding people from getting helped by us because they might have something on their record that might concern us. I think it's useful to know these things about people, but I think it's also really necessary that we understand context and severity and what's actually going on with the violence. And then finally, I generally believe that some amount of rules, whether they're just a few rules, as someone who Allison said, or are other on the other end of things, people have a lot of expectations that they lay out clearly because there's a belief that if they get this out clearly for people who will be more able to comply. So I'm a little agnostic on how many rules people should have, but I tend to believe that it's really important to be really checking ourselves all the time about, first of all, whether we're creating a rule when there's a problem that arises around someone's behavior, or whether it would really just be much more beneficial to just sit down and have a conversation with someone about what's going on. My experience is that if someone is not complying with rules, there's usually something behind it. Sometimes that can be resolved if we really just have a compassionate approach and sit down and talk with people in a way that is open and really wanting to understand, rather than just kind of trying to put this template of our shelter rules over this person's life and have an expectation that it's necessarily going to work. So, something, it doesn't always work, but sometimes I think it frequently can. So the last thing I want to just say, I'm going to close and let you all have your conversation, so we can go to one on the slide. I want to use a quote from a Kenyan writer and author, or she's a poet named Warsan Shire. And she said, "No one leaves home unless home is the mouth of a shark." And though she's referring to people who are fleeing more social and political violence, it really also resonates for me regarding people who are fleeing their homes because their homes feel unsafe. And so I try to keep that reality in mind when we're considering how hard it is for people to come to the point where they ask for the kind of help that shelters provide. And some people talked about this when we had a couple opportunities to talk. People don't know what's it going to be like there. What's going to be expected of me. Whom am I going to have any privacy? Who am I going to live with? Am I going to get kicked out? How long can I stay? All of those things, when you pack on the history of violence, the trauma, and even perhaps substance abuse and mental illness, all of that can really be compounded for people. And of course, they're coming to us at the very worst time in their lives, which may very well reflect how they engage with us. And so I guess that's kind of what I have to say. You're all free to disagree with me, although it sounds like we have a lot of agreement. And so it's time, Twyla, for you to just kind of facilitate another conversation. Thanks, everybody.
Thank you so much, Denise.